Hello everyone, it's Dr. Adam Tedder from Upper Cervical Chiropractic of Georgia again. I just wanted to touch base with you guys again about a story I told you about a few weeks ago about the young girl with migraines. I want to give you a little bit more information, some pictures maybe to explain what was going on with her and how our care helped her get past that ailment. So today I want to talk about what we found with her x-rays and how this applied to her, because she had been to a lot of other doctors, and there may be a lot of you out there that have been to a lot of different places, maybe get a little bit of relief but nothing like a permanent solution. So if that's you and you've gone through medications and massage and different things, this upper cervical problem might be what's causing the migraines you're dealing with. And for this young lady, what we found with her is a misalignment of the top bone in the neck, okay? I know a lot of you guys aren't real familiar with x-rays, but if we look at this picture here, this top bone right here looks like an airplane. It's called the atlas. A little bit better picture is this model here. This is the head, back part of the skull, the first bone, which is the atlas, the second bone, which is the C2, then C3 right there below it. The bone we found out of alignment with this young lady was the top bone, which is the atlas. What had happened is that bone had shifted out of place. And what that does, it causes two things to happen. The first, it compresses or squeezes on the brainstem, which is this black area of this model. The brainstem is your Houston control. It literally controls everything from breathing, heart rate, digestion, all the functions of the head, face, and neck. It controls everything. So this compression blocks its ability to create a communication pathway between the brain and the body. That's what was happening with this patient here. Secondarily, what happens is if you can see right here, this white cord, that represents the vertebral artery. When that bone rotates out of place, it compresses that artery. That's where we find a lot of times with migraine patients, they get this pounding, or that pounding headache is the vascular component of the migraine. Okay, so when that bone rotates out of place, it's causing pressure on the spinal cord, and it's also causing pressure on the vertebral system, or the arterial system going to the brain. Okay. The second thing that happens is it takes the head and neck out of its normal position. So it causes our head to go crooked, it causes our head to fall forward, and it creates a lot of tension here in the upper cervical area. This is also where we get tension type headaches, where we get the pain that comes up over the head and behind the eye. That's because the muscles in the back part of the head begin to tighten and compress the occipital nerve, which causes that shooting pain up over the head. Okay, so we look at this x-ray for this young patient. The blue line is actually where her neck should be. You see her whole head and shoulders and neck are all falling forward, and we're losing the curvature and the normal structure of her spine. And you can also see this bone right here is squeezing down or compressing down on that second bone. That's the pressure that we're looking for with a patient with these types of symptoms. Okay. Secondarily, what we look at is we look at deviation of the head, neck, and shoulders. So this is a front view of this patient. This is her left side, her right side. You can see her whole head and neck are deviating to the left side of her body. You can also see her shoulders are starting to tilt. So this curvature we're getting in her spine causes a lot of tension in that area. Over time, what that causes is pain. It can cause muscle tension, headaches, dizziness, a lot of different issues, because the head, neck, and the vestibular system are thrown off of balance. And so for this patient, we started adjusting her based on what we found on these x-rays, and over the course of 30 to 60 days, completely well, no migraines, no pain, doing awesome, back in school, doing everything that she's designed to do. So if you or someone you know is dealing with these types of problems, they've been everywhere, they've done all different types of things, and they're not finding answers, upper cervical might be the option for them. So give us a call. You can visit us at www.getwellga.com. And again, my name is Dr. Adam Tedder with Upper Cervical Chiropractic of Georgia.